And now, a session produced by our underwriter. Please welcome to the stage Darrell Kirch, President and CEO of the Association of American Medical Colleges.
I really want to thank everybody for being here this morning and thank the AtlanticLIVE for allowing us to be the underwriter of the session. I'm actually stunned to see so many of you here given the must-see TV event that occurs later today. You know, I've been listening to this morning's discussions, partly as a person who works on policy in Washington, but mainly as a doctor. And now as a doctor who's privileged to work with the people who I believe whatever happens on the policy side are going to be critical to actually making the system work better. You know, if we're going to achieve the kind of health care you and I want for ourselves and our families, three things have to come together. No one of them or two of them is sufficient. All three are necessary. We have to educate a different workforce, a workforce that can see the kind of care that needs to be delivered in the future, not the kind of care we deliver today with all its inefficiencies and all its high costs. Together with that education, we need to move the science forward. You know, every time we develop a better treatment, or even better than that, a prevention or a cure, we end up with a healthier nation. And the third ingredient is just the people and the places to deliver that care, the healthcare delivery unit. Those three things come together in only one place in this country, and that's in academic medical centers, where medical schools, other health profession schools, teaching hospitals, clinics come together. And I'm humbled that for the last 13 years I've had the opportunity to lead the AAMC, which stands for Association of American Medical Colleges, but is so much more. It's those med schools partnering with other health profession schools, together with research institutes, and then the hospitals and clinics in which they train, develop science, and most importantly, take care of people. Some of what you've heard today is how divided we are. I want to tell you how optimistic I am. I've visited, because I've had a longer tenure, I'm now down to having visited all but 8 of the 152 U.S. medical schools. And every one of them, I see the next generation being educated, and I have great confidence that they're going to be able to address a lot of the problems you've heard described today. Today's students talk about the fact that zip code, your income, your education, matters more than your genetics and how your health status is going to turn out. They care about. I also felt like I just lost the microphone, did I? They also care about working in teams. There used to be a lot of tension between doctors and nurses. Today, interprofessional education is the standard. If you go 2 blocks down K Street to the building we live in, we're in the same building with the colleges of nursing, the physician's assistant programs, the dental schools. We know we need to form up as teams. We're using virtual reality, simulation technology, so that instead of practicing on patients, medical students can learn by very sophisticated methods. The education is truly being transformed. The thing that worries me about the education is the fault of me and my fellow baby boomers. 10,000 of us turn 65 every day. Think of the burden of illness that's going to be growing as the boomers age. Most of them are like me. We plan to ski until we're 90, even if every joint is titanium. This is going to put a load on the healthcare system. We do an annual workforce analysis, and our best estimate is that by 2030, when the last boomers are turning 65, we will be short somewhere between 42,000 and 120,000 doctors in the US. That should concern every one of us. This is an all-hands-on-deck situation. On the policy front, we need help in Congress to increase the number of training slots that are federally funded for residents. I'm optimistic because of the science. When I was a med student on a pediatrics rotation, I wasn't prepared for the fact that children diagnosed with leukemia had an almost certain death sentence. Only 10% survived. Today, that's well over 90%. That's what science can do in this country. And now we're seeing it with immunotherapy, more and more sophisticated organ transplantation. I think it was mentioned in one of the sessions earlier. There was a recent study that showed that every drug approved in the US between 2010 and 2016 could be traced directly back to NIH-funded research, the majority of which is done at the medical schools and teaching hospitals. And lastly, on the healthcare delivery side, only 5% of the hospitals in the United States are teaching hospitals, but they deliver a much greater percentage of the care. And when it comes to the vulnerable and the underserved, they deliver a quarter, 25% of the care to Medicaid patients in the country, and over 30% of care to the uninsured. And they also are the places that you will go when you're really in trouble. If you need a level 1 trauma center, if your baby needs a NICU, a neonatal intensive care unit, you need a burn unit, the odds are good you will be at one of our teaching hospital members. I have great optimism. When I was a medical student, I wouldn't have believed I would get to this point in my career and we still wouldn't have solved some of the health policy issues in our country. And I think all of us are committed to trying to find solutions on the policy front. But what makes me feel great and have hope for the future is just how ready I've seen America's medical schools, teaching hospitals, their community partners, how ready we are to solve these problems with you. So thank you again for coming this morning, and thank you again to AtlanticLIVE for allowing us to underwrite the sessions. Have a great day.